My name is Mary.
So, what's the date of your birth?
April 12th, 1998.
Okay, how old are you now?
I'm 20 years old.
Okay, so today I want to be doing some neurological assessment with you. So I will start from up downward. So, Miss Mary, can you stand up for me? I will first of all start with some cranial nerves assessment. So, let's start with your eyes. So, with the eyes, can you can you see properly? Do you have double vision?
No.
So, I want to see the if Miss Mary can read this to check the accuracy, the optic nerves. So, can you read this, the first line,
Uh,
by
E
standing by the 6 feet? Okay, the third line. No, you have to cover your eyes.
F P H
Mm-hmm. Then the last line.
L T
Mm-hmm.
T P H.
Okay. So now, um, okay, the second eyes. Do the same thing. First one,
E
the third one,
F P H
and the last one.
F T F P H.
Okay. So Miss Mary accuracy is 2020. So I'm gonna start with the um looking at uh, the eyes, the pupil by Miss Mary. You're going to look into this light straight. So I'm checking for accommodation. So the another eyes. So the pupil reacted by constriction and focus on the light. So and the pupil are equal. The eyes are symmetrical. Really, I'm not really doing the eyes examination, but I'm doing neurological examination. So Miss Mary, you're going to point to your nose and point to this my finger as it's moving. Okay, good. So now I'm going to check for peripheral vision. So tell me when you see the hand moving. Okay, that cranial nerve is intact. So I'm going to check for auditory nerves by using my tuning fork. Oh, you feel the vibration?
Yes.
Do you see the vibration?
Yes.
Do you see the vibration?
Yes.
So does it the sound equal at the different side?
Yes.
Okay. So another one is when I say something, you say it back to me.
99. 44.
Okay, so that is intact. The hearing, you can hear good. So can you hear that sound?
Yes.
Can you hear that sound?
Yes.
So I want to check for sensory. Just touch Miss Mary with a very soft, urgent, uh, some white, something here. Okay. So when you feel, you say, close your eyes. When you feel, you say yes.
Yes. Yes. Yes. Yes. Yes. Yes. Yes. Yes. Yes. Yes. Yes.
Okay, the sensory. It's okay. So I'm going to pinch you with some pen and close your eyes.
Yes. 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 Yes.
For some patients that have neurological problem, they don't feel anything like pain touching them. So that is that. Can you smile for me, Miss Mary? Can you frown? And can you blow your cheeks? Can you move your tongue forward? Okay, okay, that's good. And can you swallow for me? Okay, they are good. So that is that. Now we want to move to the your neck. When I press it, you press back. Okay, again. Okay, there's a resistance. So when I press this down, you press it up. Okay, there's strength there. Then your hand too. When I let me have your hand. Lay your hand on me. So we're going to use the bicep posteriorly, and the hand will react by jacking. No, you are don't restrict it. You need to you need to do it according to how it's supposed to be. So relax your hand completely, completely. So when I bend this, don't restrict the movement. Yeah. So give me that. Okay. The same thing happened to this one too. So there's a movement there. Another one is I'm moving to the muscle in the leg. I'm going to test. Yeah, there's a little bit movement there. May I show the computer so that they can see. So, see? Movement. Then again, you relax. And you can close your eyes if you can. Like kicking, yeah. So a little bit kicking. So another one, you can do it at the back of the ankle. So, okay. Like that. Don't restrict it. Don't restrict. Okay. So, Miss Mary, another one is I want you to stand up. You will walk a normal walk from there to this place. Normal walk. I'm just checking the gate. Yeah. So can you walk with your leg back to back? Yeah. Come back again. No, you have to touch. Yeah, good. Okay, that is good. Then can you walk with your heel to that place and walk back and close your eyes? Okay, then come back. Okay, another one, can you walk with your heel? Okay, that is good, Miss Mary. You can sit down. So now, can you close your eyes and raise your two hands? Your hand, two hand up. No, not that too much. Like that. So no, you don't. You let it go. You let it. You let it go. You let it. The reaction. Let it do the what is it. You don't need to restrict it. And that hand should not go beyond the same level. No, it's supposed to come back to the same level. So you will not let me put your hand down. Put it up. Close your eyes and let your hand be straight. Yeah, yeah. That's how it's supposed to be. So you will not let me pull it down. That's good. That's how it's supposed to do. Yeah. So you can put your hand down. Then another thing is I want you to stand up again. Okay, that's for the balancing and coordination. So I want you to raise your hand, your two hands, and close your eyes for some times. And you will not, you will be, when I'm trying, open your hand widely. When I'm trying to close your hand, you will be restricting me. You will not let me close it. So I'm trying to put the finger together. Yeah. So she's not allowing me. So yeah, you can see that's how it's supposed to be. Yeah. So good. And another one is for balancing, you put your leg together and close your eyes. Put your leg together, close your eyes, and stretching your hand. If you can do it for some minutes, yeah. Some patients cannot stand it like this and stay for a minute. Unless they fall because they lack balancing. That's their 4 risk assessment. So, thank you, Miss Mary. Do you have any question? You can sit down.
No.
So, I'm going to put some objects in your hand, and I want you to close your eyes, and you will tell me what kind of object I put in your hand. So, do you ready?
Yes.
So, close your eyes and close your hand. What do I put in your hand?
You put a battery?
Yeah. So she got it. So that's another thing. The last one we do. Wait. Open your hand. What do you feel? No, you close your eyes. Put your hand together. When I do what I do, you tell me what you feel. In which hand?
This hand?
Which hand? Is it left or right?
The left. Left. Right. Left. Right. Right. Left. Left. Right.
Okay. So Miss Mary, neurological assessment is intact and there's no problem. Then the last one we're going to do is this. I'm going to share for muscle strength. You can lay down when we do that. I'm going to do some range of motion. So like adduction and extension. So the range of motion, there's no restriction, there's no stiffness. So Miss Mary can move the hand. Uh, good. Let me see the second hand. So the range of motion is good. So I'm going to check the leg. Can you widen your leg? So yeah. Do you feel any pain?
No.
This was most doctor do for any sciatic problem like low back pain. Some patients this flexion will not be complete and they will begin to shout for pain. So and this is good range of motion. And another one is I will be, Miss Mary, I will take your hand. You will not let me to put your hand down. Can you put your hand up? You will not let me pull it. Can you raise your two hand up? So when I'm pulling it down, you resist it. Okay, good. And your leg too. Raise it up. When I'm pulling it down, don't let it. See? Again? Yeah. So that is good. So that is the end of the neurological assessment. Thank you.